Good afternoon and welcome to our educational webinar, Expanding the Sleep Tech Role with CCSH. My name is Rachel Bohr and I'm the Senior Marketing Director at Enzo Data. On behalf of the entire Enzo Data team and in the spirit of Sleep Tech Appreciation Week, I want to thank all of the sleep techs that are joining us today for everything that you do to help your patients improve their quality of life through sleep. Also, we appreciate you taking time out of your busy schedules to join us today for our webinar. And now I would love to introduce you to Amber. Amber Allen has been in the sleep field since 2008 and currently serves as the Program Director for the CAHEP accredited Polysomnographic Technology program and the BRPT approved CCSH STAR program at Collin College in McKinney, Texas. She was instrumental in the development of the program and building it from the ground up. Before joining Collin College, she worked as an RPSGT for the Cleveland Clinic in Cleveland, Ohio. Amber has spoken at numerous sleep and respiratory care conferences at the international, national, and state levels, and currently serves on the BRPT Board of Directors as Secretary and Chair of the CSTE Committee. She's passionate about educating students and the public about the importance of sleep. Amber graduated in December 2021 with a degree in cybersecurity and works on the Healthcare and Public Sector Coordinating Council Cybersecurity Working Group, a federal advisory committee that collaborates on cybersecurity initiatives between federal agencies and the healthcare industry. And with that, I am going to pass it over to Amber so that she can give us a wonderful presentation.
Well, thank you so much for having me. I'm excited to share about how we can expand the sleep tech role with CCSH. A lot of times I hear when technologists are looking into this credential, the big question is, what can I do with it? What is the benefit for me to get this credential? And so I'm hoping with my presentation today, I can kind of give you some ideas about how you can use it in your clinical practice. So as far as conflict of interest, I'm not selling anything here, so there's no real conflict of interest. I do serve on the BRPT Board of Directors, which is what puts out the CCSH credential, but other than that, I don't have any disclosures to state. So as far as the learning objectives, I really want to dive into how to expand the sleep technologist role, because we have this kind of perception of what we can do as sleep technologists, but there's a lot of things that if we think outside the box and how we can expand our clinical practices, there's a lot that we can do as sleep technologists. And I'm going to dive into what is the CCSH credential and how do we obtain it. There's different pathways to get to it. And then I'm going to dive into what the knowledge base that is needed to really be effective in a clinical sleep health role, because it does require an advanced knowledge base. And so there's different areas of sleep medicine that you have to be well versed in order to be effective in this role. And then I'm going to talk about how to use the CCSH credential in the sleep medicine practice and how you can also expand it beyond the sleep center walls so that you can use it in different practices to reach different patient populations, so that we get more patients diagnosed with sleep disorders and on courses of therapy. So the big question is, why change? And I love this photo here because it shows, the same old thinking produces the same old results. And so we know that sleep medicine has changed radically, and we see every single decade that there's some sort of big change and initiative that comes in the field. The 70s were kind of the start of the field, and then we see in the 80s we go and move into CPAP therapy as an option for sleep apnea. 90s were more the digital age where we went from paper to computer-based systems. We started to see home sleep apnea testing and education kind of play into the roles within the 2000s and 2010s. And now we're starting to see more technological advances within the field. And so we can't keep doing the same old thing and get the same old results because the field's not the same as it was previously. So we have to be mindful of that and kind of think outside the box of what we can do as sleep technologists. So we still have the role of running sleep studies at night, but there's a lot more that we can do beyond just being the nighttime techs. So we have to look at what are the reasons that people resist change. So the first one is lack of clarity and fear of the unknown. What's going to happen to my job? You know, if you've been very comfortable in your job for all these years, you may look at things from that perspective of, why do I want to change? What's going to happen to my job? Am I going to like my job once I embrace this change? So that lack of clarity, what does the picture look like? What will I be doing? The lack of skills. Do I know how to do this new thing? Do I need to go back to school? Do I need to do some sort of online training? Do I need to go to some sort of class? What kind of skill sets will I need to do this new thing? And so how do I get those skills? An overcommitment to the current model and a change to routine. You know, you like the way things have been done. You don't want to change what you're doing. You want to keep doing the same old thing, but yet the practice is changing. And so how do you adapt to that? Lack of trust. Will this do the job I need it to do? You know, do I have trust that I'm going to enjoy this? Do I trust that I'm not going to be worked in a way that I'm not comfortable being worked? Do I feel like I have confidence in it? That fear of being left out. Why wasn't I included in this decision if it affects me the most? You know, why wasn't it discussed with me? We're going to start changing our practice to do this, but why wasn't I part of that decision-making process? And that resignation or perception to change. Just because you're compliant with a change doesn't always mean that you're satisfied with your job. So there are people that will go and follow through with the change that's going on in the practice, but yet they're not happy. They don't enjoy their job anymore. And then the other reason is inadequate benefits and rewards. You're expecting more of me, but yet my pay structure is not changing. I'm not getting any financial benefit out of this. I'm not getting any kind of reward for doing this. You know, you're expecting me to do things that are different. I might not enjoy it, but yet I'm not getting compensated for it. So those are some of the things that factor into why people do resist change. But as we move towards a future, we know that there is change happening. So what do we know? We know that technology is playing into this. Technology is just evolving so quickly, and we're seeing so many things being introduced into the marketplace, and we're starting to see a consumer awareness of sleep because they have access now to sleep data from their Apple Watches, from their iPhones, from their Fitbits. And so we know that we have a change also in our diagnostic process because of technology with home sleep apnea testing, wearables, you know, PAT testing. So there's a lot of things, artificial intelligence, that are all factoring into the way that we're doing things in the sleep lab now. But technology on the flip side is also increasing access to care because we're seeing patients that may have not had access to sleep practices before, with telemedicine being able to access that care. We're seeing an improvement of outcomes with having apps where the patient can track whether they're being successful at their therapies. And then enhancing that patient and physician satisfaction while at the same time reducing cost. So the patients are more content to be able to sleep in their own beds and get tested, or feel like they're part of the process because they're seeing some of the data that we're looking at, and so therefore it's making them more happy and more likely to be compliant with following through on their therapies. So there is a lot of things that factor in here and how we're changing things and moving forward. So talking about artificial intelligence and machine learning, that's a big part of a lot of the technologies that are being used even in the consumer marketplace. When we look at artificial intelligence, this is the techniques that enable machines to mimic human behavior or exceed human capabilities. So these are things like your smart calculators, your Nest thermostats that can go and program your temperature, your Roombas that can figure out the layout of your room and clean your room, your Google Calendar that learns when you get an email for something to plug it into your calendar as something that's going to be part of your routine. And then you have the machine learning, which is a subset of artificial intelligence techniques that utilizes statistical methods that enable machines to improve with experience. So things like face recognition, as your face recognition software starts to learn the dynamics of your face, it recognizes you with your glasses on, and they've even gotten it to the point where it can recognize you based off of when you have a mask on. Things like Shazam that can hear just a little bit of a song and figure out what that song is. Facebook ads, it kind of learns what you're Googling, and you'll see an ad, and sometimes it's kind of creepy because it even looks at things like, I just thought about that, now I'm getting a Facebook ad for that. So it's kind of interesting how machine learning works. Spotify, Netflix, that'll give you recommendations based on your watch history. Like even my iPhone will tell me when I hop in the car and plug it into CarPlay, it knows when I'm going to work versus when I'm going someplace else that's part of my routine. So it learns your behaviors, it learns and it improves with that experience. So I can get kind of up-to-date things and process that. But as good as technology is and as innovative as technology is, it still doesn't replace that human touch factor. And that's where the clinical sleep health professional comes into play, because they can help to foster that continuum of care, highlight areas to focus on, and provide education to the patients, to our medical peers, and to the community. So we still have that need for that human touch to go out and work with those patients. The machines are great, they can do a lot of stuff, but they can't do everything, and they can't replace kind of that motivating factor that we see from the human touch capacity. So how do we expand our role? How do we make our mark? And that's what I'm going to dive into and talk about some of the different roles that you can do in clinical sleep health and how you can make your mark with these roles. So the clinical sleep health role is really a physician extender type of role. It aids with patient, provider, and community education. So that three-faceted approach to sleep medicine: patient, working with other providers, and working with the community. But to be really effective in this role and really impact those three areas, you really have to have a deep understanding on the following topics. You really have to understand sleep architecture and variances. What do we see changing as a patient ages? What should we expect to see with their sleep? How do different medications impact that architecture? How do gender roles impact that architecture? How does, different environmental factors, all those things that factor into sleep architecture. Sleep disorders diagnosis and treatment. You really have to be well versed in the ICSD-3 to really understand the different sleep disorders, what their diagnostic criteria is, and what their treatment criteria is. Once you have a good understanding on that, you're able to work with patients in a variety of settings. A lot of times, a lot of sleep techs, their main focus is sleep apnea, but they don't learn there's 99 other sleep disorders out there that a patient may be suffering from, and understand that diagnostic process, these signs and symptoms, and what treatment would be entailed. Comorbidities, looking at comorbidities and how they factor into that sleep disorder diagnosis and how they'll impact that patient's treatment. Practice parameters and guidelines, knowing how to run the different types of studies, how to run the different types of treatment titrations. Patient education styles. There are different patient education styles that you have to keep in mind. Some patients will be more of an auditory learner, where you can talk to them and they get the education. Some need to be visually shown how things work. And some are kinesthetic, where they actually have to have a hands-on approach to working with that device and really using it while being educated. And then compliance. We have to understand what is required of that patient to remain in compliance with their therapies, and then work with that patient to be compliant with their therapies so that they don't lose their device. So sleep health educators really need to be well educated. This is not something that is basic knowledge. This is an in-depth knowledge, and you almost have to know as much as the physicians themselves to be highly effective in this role. And the CCSH credential is one of those ways that we can help to test the knowledge base to see if you have that in-depth knowledge to be effective in a role like this. So what is the CCSH? The Certification in Clinical Sleep Health exam is an advanced level exam for healthcare providers and educators who work directly with sleep medicine patients, families, and practitioners to coordinate and manage patient care, improve outcomes, educate patients in the community, and advocate for the importance of good sleep. And there's a reason why certain words are underlined in this definition, because coordination is a key, because you want to have sleep be part of that patient's whole perspective, their whole medical care. And so how do you coordinate with other providers to manage that patient's care so that sleep is part of that factor? We've seen that if patients' sleep disorders get corrected, they get on a course of treatment, that we do see an improvement in outcomes and a reduction in readmissions. How do we educate patients in the community? A lot of people in the community may not know that they have signs and symptoms of a sleep disorder. They just chalk it up to, that's just the way I always sleep, and they may not know. And so how do we educate patients that are not patients yet? You know, how do we get them to understand that it is a problem that should be evaluated? And advocating for the importance of good sleep. You know, a lot of people don't realize how critical to their body's processes sleep is, and we have to advocate for them to get better sleep and to get diagnosed and to get treated, as much as they don't want to admit that they may have a problem, or as much as they're resistant to the idea of, you know, being on treatment for sleep apnea, for example. There's an advocacy that we need to do to show them the quality of life that they have by getting this treated. So the CCSH exam is a computer-based exam. There's 100 multiple choice questions on the exam. 75% of those are scenario-based, so they'll give you a scenario that is talking about what's going on with the patient, and you have to be able to critically think your way through the scenarios and answer the questions. And then there's 25% of it that's just general questions. You have 3 hours to complete the exam. Once you apply for the exam, you'll get an approval email from the BRPT, and then you go and schedule the exam through Pearson VUE testing centers. And they have centers all across the globe that can be scheduled to get that test done. So you schedule it through them, and then when you go into a Pearson VUE testing center, you take the exam, and then as soon as you hit the submit button on that exam, you're going to find out if you're a CCSH or not, because those exam results immediately pop up there. So you'll know when you walk out of that center whether you can add those letters behind your name. And I will tell you, it's one of the most nerve-wracking things to hit that submit button and wonder what's going to pop up on that screen. I've been there, I know how that is, and so you get that sigh of relief when it pops up, you passed. And so that is the process for the CCSH exam. There are different eligibility pathways, though, for the CCSH exam. So I'm going to break down each of these pathways in the upcoming slides, but pathway 1 is your clinical experience, pathway 2 is healthcare credential, and then the newest pathway is pathway 3, which was for active RPSGT credential holders that have recertified at least once. Back when this credential started, there was a CSE pathway that if you took a one-day course, you had a pathway through that course to take the exam, but that expired in 2017 and is no longer a pathway for the exam. So pathway 1 is a bachelor's degree or above that has a minimum of 1,000 hours of cumulative direct experience in clinical sleep health. So if they're doing education, counseling, management, coordination of patient care and outcomes in the sleep health realm that has been validated and approved by a clinical manager, a sleep medicine practitioner, or a sleep health specialist that has the CCSH credential and a bachelor's degree, that's the eligibility pathway 1. So there is also international equivalence as far as the degree requirement. And so you have to provide proof of that the education either through an official transcript, diploma, letter, or certificate from the education provider. If you have multiple degrees that are, you know, whatever the highest level degree is, that's the only one that you need to submit with the application. And then of course having BLS or the international equivalent for that. Pathway 2 is an associate's degree or above, but you also have a current healthcare credential or a license that's listed on the BRPT's approved credentials list for Pathway 2. My next slide will show some of those credentials that are approved for Pathway 2. So if you have one of those credentials and an associate's degree or above, or the international equivalent for that, you're eligible under Pathway 2. Also, BLS is required for all of our pathways. So the approved credentials that we have for Pathway 2, you can see here, and this gets expanded upon periodically as the board reviews credentials for Pathway 2, but these are some of the ones that are listed on there currently. And so if you have that credential and an associate's degree, you would be eligible for Pathway 2. Now, if you don't have an associate's degree or higher and you don't meet the criteria for pathways 1 or 2, but you do have the RPSGT credential and have recertified at least once, which means you've had the credential for at least 5 years, then pathway 3 is the newest of the pathways for the BRPT for this CCSH exam. So To be eligible for that pathway, recertification once, which means 5 years with the RPSGT and that you have renewed it once. And then you have to also complete a CCSH STAR designated self-study education program. The BRPT's website has a list of all of the CCSH STAR designated programs. These are self-study module programs, so they can be done remotely. And so once you complete those and show proof of that completion, and that all of them have a post test that has to be passed in order to get that certificate of completion. So once you pass the post test and have your certificate of completion and you show that you've recertified once, you're eligible for pathway 3 with an active BLS as well. So those are the pathways to get to the exam. But once you get the credential, the CCSH credential, what can you do with it? And that's where I'm going to dive in the next several slides over roles that you can do as a CCSH within the profession. So you may have heard of titles like sleep navigator, sleep educator, sleep coaching, and I'll go into what's the differences between these 3 areas. So I'm going to start with the sleep navigators. These are the individuals that are working with patients, the healthcare team, and community resource providers. So they're serving as that bridge between another healthcare specialty and the sleep community. And so we find with this role, it's more of a cost-efficient option than hiring physician assistants and nurse practitioners. And no offense to the physician assistants and the nurse practitioners, but usually when those roles are coming into the sleep medicine practice, they have to be trained on sleep. They don't have a knowledge base on sleep. And so then it takes time to train them, and it takes money to train them in that process. Whereas with a RPSGT that has transitioned into a CCSH role, they already have the knowledge base in sleep. And so it could be a more cost-efficient option for the practice to utilize a sleep technologist with a CCSH credential. The purpose of a sleep navigator is to help identify sleep disorder breathing in inpatients for diagnosis and appropriate treatment. So working a lot in the hospital setting to work with patient populations that are high probability for sleep disorder breathing, but may not be diagnosed. And the findings are that if sleep disorder breathing gets evaluated and treated, that's going to lead to better patient outcomes. The patient's going to stay less time in the hospital. They're less likely to be readmitted, and they have better mortality rates. So it's kind of a no-brainer when you think about it, that the importance of sleep and how it improves outcomes is a critical thing. And so this role is a critical way to kind of introduce other medical specialties within the hospital network to sleep and how we can use this for our patients. So how might the sleep technologist be integrated as a sleep navigator? So one of the roles is using clinical sleep education for patients. So educating them on sleep disorders that they're at high risk for because of the health conditions they're in the hospital for. Visiting those inpatients on the hospital floor. So either having studies run on those patients while they're inpatients, or if they have been put on CPAP, making sure that they're using their CPAP during their hospital stay. Following up with those patients after discharge to make sure that they understand how this sleep disorder is impacting them, and to make sure that they do get on treatment and stay on treatment after they've been discharged from the hospital. Providing results to the patient's physician. So serving as that liaison between the sleep practice and the physician that has referred that patient into the hospital. So working with them to help the physician understand how their sleep disorder is factoring into their overall care. And then updating and providing results to the clinical staff caring for the sleep patients. So working with those allied health professionals that are touching that patient on a daily basis, and making sure that they know that, hey, this patient is a sleep apnea patient. They should be on CPAP whenever they're sleeping, and making sure that those clinical staff are aware of that patient's care plan. And then long-term planning for therapy, helping that patient get on a care plan so that they are getting continuous follow-up, and that way that their sleep disorder is being managed properly. So this is ways that sleep technologists can be integrated as a sleep navigator. And we've seen that sleep navigator roles are really highly effective. This article here that's in my slide shows that sleep apnea screening in heart failure and COPD patients reduces readmissions at a hospital in West Virginia. And so we're seeing that if these patients get screened and they get on appropriate treatment, they're less likely to have to go back into the hospital. Dr. Sharma has this quote. It says, "It is a testimony to the success of this program that we are now getting 4 to 5 consults a day to use this service. The benefit of the program has transcended several departments and specialties, and we are often consulted to screen patients in order to detect the disorder and intervene in the hopes of positively impacting patients' comorbid conditions." So once we have physicians starting to see the value of this role, it makes it where it opens doors for us to kind of go into these different areas that we may have not been able to go to before. So I'll talk in a later slide about how having these statistics and showing these physicians and decision makers the value of this can really benefit as you're trying to initiate this in your own practices. For inpatient screening, OSA probability screening tools should be administered when the patient gets admitted. So that way the patient, the entire time they're in the hospital, are being looked at. If they're high probability, they can get tested, and then trying to get them on a course of therapy. Evaluation is really important in your preoperative evaluation, especially in those patients that have congestive heart failure, stroke, cardiovascular disease. A lot of major surgeries now are wanting sleep evaluations before the patient has that surgery, because they know of the mortality risks. If that patient is under anesthesia, they are a sleep apnea patient, not on CPAP and recovery, and how that can cause complications and possible death. Patients that get diagnosed with OSA should use their PAP during their hospital stay. So that's part of that clinical education with the care staff, the clinical staff that's working with those patients, to make sure that they are using their PAP while they're there. Then the sleep educator role is another role. So we dived into sleep navigator. Now I'm going to touch on sleep educator. And this is more of an outpatient type of setting. So this is working more with our private practices, educating those patients that are moving from home sleep apnea testing to auto PAP. What the CCSH is doing in this role is reviewing the study, looking at the AHI, the OSA, what causes and comorbidities the patient may have, and how this relates directly to the patient's symptoms and comorbidities. So really taking that holistic approach of looking at that patient, what's causing the issues? Are they, possibly a positional type of apnea? Do they have any comorbidities that could exacerbate the OSA? These are all things that can be looked at. And so you can have a real in-depth education with the patient to make them understand how their OSA is impacting their overall health and how their treatment is benefiting their health. Durable medical equipment. Patient education is really critical to improving PAP compliance and success. So it really helps to have a CCSH in a durable medical equipment role, because you're going to make sure that that patient gets proper mask fit, proper education on their mask and their device, and also how to track compliance and make sure that patient is being compliant with their device. Physician referrals, screening high probability cases for physicians in other practices, and providing education to those high probability cases. So working with physicians in other specialties so that you can get those referrals into the lab. And it's been shown that PAP compliance rates are higher with proper education. So if you want to get a patient to be using their PAP therapy and be successful with it, giving them a good in-depth education on the benefits of it and why they're using it really helps them to be compliant. And then we have the sleep coach role, which is a little bit different. This is more of a one-on-one type of case that's focusing more on motivational intervention. So it's focusing on habits, intrinsic motivation, behavioral change, patient empowerment. So kind of, how we have our sports coaches that are giving the players and the athletes tips on how to improve their performance. That's basically what the sleep coach is doing, is they're giving these tips to the patient. They are not doing anything like CBT or therapy or counseling with the patient. That's not within their scope of practice. But what they're doing is basically motivating and pep talking patients into using their therapies. So they're working closely with patients and with the treating team to help them stick by their health goals by providing additional education and support. So explaining again in depth what this disorder entails, what this treatment entails, and encouraging that patient to use those therapies. The other thing is a lot of times people will reach out for a coach, and there's so many coaching opportunities. If you go and Google sleep coach, online, you'll find all these people that are doing sleep coaching. And so it's good to get one that has the CCSH credential just because they have that in-depth knowledge in sleep. But there's a lot of sleep coaches out there that are sleep coached by, either they got their kid to sleep very well, or they've got another family member spouse to sleep well, and now they think they're an expert on sleep. So you have to be kind of careful with the sleep coaching realm. But a true sleep coach is going to be able to connect the patients with a boarded specialist and partner with physicians, behavioral therapists, other providers to really improve that patient's sleep health. So we want to see the end goal of, in all of these roles, for a patient to get better sleep. And so these roles can each be used in their own special ways within the sleep medicine practice. So why are these roles important? For one, it provides a patient focus. And when the patient feels part of the process, they're more likely to be compliant with the process. The other thing is provider education. A lot of these providers do not have much sleep education, so they don't know what to look for when they're working with their patients. And then it also promotes healthcare collaboration. When we look at a patient as the whole kind of model and look at things like collaborative medicine, we have sleep being part of that patient's process, part of that patient's care. So it's affecting their overall health, and it's not being subset and just looked at something as not as important. When it's shown the importance and how it connects to the other issues that patient has, it's more likely that the patient will take it seriously and get the appropriate care. So the big thing that we see is this move to patient-centered care, evidence-based practice. So the idea of viewing the patient as a whole, or the patient-centered care model, is really this big focus in healthcare, because there's a link between insurance payments and patient-centered care. It really focuses on the patient, what's best for them, and it lets them have a voice in their healthcare. Patients need quality time to retain health information, because it's been shown in studies that when you give patients all this healthcare information, they forget about 80% of it. And so you have to have repetition, and this move to patient-centered care and using these coaching and navigator and educator roles helps them to remember what they're doing and why they're doing it. And it's also a big key in disease management. The IOM report on sleep and sleep deprivation way back in 2006 said there are numerous reasons for a paradigm shift to chronic disease management. Proper treatment for most sleep disorders, as for other chronic diseases such as congestive heart failure, diabetes, asthma, and depression, requires a period of time for fine-tuning, extended follow-up, and lifestyle changes. Sleep disorders cannot be adequately treated in a single visit. And we know as sleep technologists, we're seeing those patients come back in. And so the disease management, most of these sleep disorders are lifelong conditions. These patients have to be managed throughout the course of their entire life. And so disease management is another way that we can, as sleep technologists, help those patients to have better outcomes. So when we look at the patient-centered care model, there's this whole continuum of care. So you have to have patient-aligned care teams, which means we have to be working together with other practices, other specialties, and working together to get that patient with a proper education of how sleep fits into their overall health model, getting the patient and their family involved, because when the patient has that support system, they also tend to be more compliant. The integration of care, so integrating sleep medicine into their overall care plan. Customer service and advocacy, working with that patient, building a rapport with that patient, because when a patient is comfortable with a provider, they tend to be ones that will follow through on their visits and tend to keep up with their therapies. Coordinated care, working in conjunction with these other specialties so that that patient is getting the proper care that they need. And then prevention and management. We know that if sleep disorders get treated, it helps with overall outcomes. And it helps to prevent more serious disease models later. So sleep is a vital role in this whole continuum of care that factors into this patient-centered care model. As far as involving other providers, most of our physicians have only received about 2 hours worth of education on sleep in their medical school education. So there is a big lack of knowledge that's there. So what we can do as sleep technologists, we can be that physician extender and go out for our sleep physicians and educate these other providers on sleep needs and how to recognize simple signs and symptoms of sleep disorders. What should they be looking for when they work with their patients? We can also educate other providers on which conditions have a high correlation with sleep disorders, things like diabetes, stroke, high blood pressure, cognition issues. Those are all things that have a high correlation with sleep disorders, so we can educate them on to look for those things. Encouraging our other providers to ask patients about their sleep habits. Usually that doesn't always fall into the routine conversation with primary care physicians and their patients. So encouraging them to ask them, what's your sleep like? Are you sleeping well? Do you feel like you're not getting good rest? And ask them questions. And then identifying key anatomical features that providers should take note of during physical exams that can contribute to a sleep disorder, such as things like deviated nasal septums, large tonsils and adenoids, and obesity. So if they can recognize these key anatomical features, then they can get that patient screened. And if they do have sleep apnea, get them on a proper course of treatment. So it's a win-win for their patients, and the providers are also seeing better outcomes for their patients as well. So collaboration is really key. So to reach more patients, we have to show other providers how sleep medicine can benefit their patient populations and lead to better outcomes. And there's so many different places that collaboration can take place in. Long-term care facilities, for example, are one of the fastest growing areas of healthcare, and sleep disorders are prevalent in this patient population. So working with our nursing homes and our extended care facilities, talking to their patients about their sleep habits, educating the staff can really be key for these patients, because I've gone and spoken in nursing homes myself, and just the eyes get big and they don't realize, you know, how big sleep factors into their overall health. And then showing case studies of your experience with helping patients or examples of ways sleep medicine can be used in a practice really can help open doors for collaboration. They want to see how this will work, and they want to see the benefit of it. So that's the thing, is being able to show what you've done and what you can do. So there are a lot of different opportunities for collaboration, and when we look at these different specialties, there's different areas where we can educate their patient populations and get them into the sleep lab. So working with pediatrics and schools, talking about things like OSA, behavioral sleep challenges. You have to have really a knowledge on childhood growth and development, what's normal for children, physiology, parent-child interaction. I love to go into high schools, for example, and educate high school students on their sleep, because most of them, they'll tell me anywhere from 2 to 10 hours of sleep a night, and they don't realize how that's impacting their body and their growth and development. So it really is eye-opening. And if you get guidance counselors on board, if you get parents on board, and talking to them about how to monitor their child's sleep, how to get better sleep, talk about the effect of technology on sleep. These are all areas where you can talk in pediatrics and schools to get them more aware of their sleep. Within OB/GYN practices, talking about things like OSA, menopause, PCOS, pregnancy, and talking about the sleep changes in each of these areas. Talk about normal reproductive physiology, how sleep changes in menopause and pregnancy, especially as the woman is transitioning through the different trimesters of pregnancy, understanding how PCOS affects sleep. So being able to educate that patient population that may not have thought of, you know, their sleep issues, they just chalked it up to I'm in menopause, or I have this syndrome, or I have, I'm pregnant. I'm just tired because I'm pregnant. You know, they don't understand that there are some things in sleep that could be factoring into that. Occupational health, talking about preventative measures, obstructive sleep apnea, shift work, talking about circadian rhythm and how to get proper sleep and how to time sleep and the need for sleep to be regulated, you know, keeping the same schedule on days that a person's working versus days that a person's off. Phase shift, how light impacts phase shift, sleep promoting guidance. Those are all things that you can talk about in the occupational health realm. Nursing homes, talking about things like cognitive decline, because there's a lot of tie with sleep and brain function. So talking about cognitive decline, sleep deprivation, irregular sleep wake. You know, a lot of these people that are in nursing homes don't realize that because they're taking naps throughout the day, they're sleeping 4 hours here, up 4 hours here, how that is irregular sleep-wake, and that is actually a sleep disorder. And so talking with them about normal changes to their sleep architecture as they age, some abnormal neurodegenerative changes. They've shown in studies about how light therapy and Alzheimer's and dementia, how light impacts their function or brain function, how they actually have better responses with light therapy, and the impact to family and quality of life for these patients. Community and society, if you talk about anything sleep, they're hungry for learning anything about their sleep. It doesn't matter what you talk about, but you could talk about things like health promotion, the connection between sleep, diet, exercise. I mean, I'm sure if you tell somebody that you work in sleep medicine, they start telling you everything that's wrong with their sleep, and they start asking you questions about what can I do different to get better sleep. So you can use this role to educate within the community. Look for opportunities to talk at your local library. Look for opportunities to do community speaking. So there's a lot of opportunities within the community and society aspect. Diabetes educators, working with the diabetes educators to show the correlation between OSA and diabetes, and talking about how sleep deprivation and fragmentation impacts insulin regulation, so that they know that if they are sleep deprived or have fragmented sleep, they're going to have a more likely disruption in their insulin regulation. Cardiopulmonary rehab, cardiology, cardiac cath labs, cardiac care units, showing the correlation between cardiac disease and OSA. We know that there's a lot of heart conditions that are tied to OSA, and so showing them how to recognize the patient may be exhibiting the signs and symptoms of OSA so that they can get that patient screened, tested, and treated. Your weight loss clinics and nutritionists, look at the correlation between obesity and OSA. Explain that the higher the BMI is, the more likely that patient is to have OSA, and how them losing weight can improve or possibly even eliminate their OSA. And talk about the appetite and fat distribution hormones that are regulated in sleep. You've got leptin, ghrelin, and cortisol that are all regulated in sleep. And so if they're sleep deprived, they're more likely to have those hormones out of balance, and that obesity contributes to OSA, which makes the obesity worse because of these hormones being further out of regulation, and it creates this vicious cycle. So educating these providers can be key on getting those patients into the lab. Dental offices. There are dental conditions that predispose a patient to OSA. Things like retrognathia, Mallampati-Friedman scores, so looking at oropharyngeal crowding with the Mallampati and Friedman scores for tonsils and upper airway obstruction. Bruxism, being able to see, you know, the flattened patterns on the teeth. This patient probably is suffering from bruxism, and so that's a sleep disorder that it could be evaluated and treated. Protrusion, those are all things that they can be looking at in their patient populations, and if they have patients that fall into these categories, to encourage them to get evaluated for sleep disorders, for OSA especially. And then your physical rehab centers, sports training facilities. I mean, the effects of poor sleep, and we're starting to see more and more of the athletes starting to realize this connection between sleep and performance. One of the biggest promoters I've seen lately on sleep has been Tom Brady. I mean, he even has his own melatonin now. He is such a big proponent of sleep, and he contributes that to the fact that he's been able to play at 45 years of age. And so looking at things like, you know, knowing that the growth hormone is released during sleep and how that repairs cells, and the quality of sleep and its impact on muscle repair and pliability. They have shown, there was a sleep physician that was talking about working with one of the Olympic athletes, and they've shown that if they get certain types, certain N2 sleep, with high spindle production, that it actually helps muscle memory. And so this Olympic figure skater was able to land jumps that she wasn't able to land before because she was getting better quality sleep and having that muscle memory impacted. So they're looking at things within the sports realm of how patients can get better sleep and improve their performance. Psychiatry, psychology, looking at sleep and psychiatric conditions. Almost every psychiatric condition has a sleep disruption. So giving sleep hygiene tips for this population. Oncology, there is looking at how cancer affects sleep and giving sleep hygiene tips for cancer patients. Ear, nose, and throat, looking at airway management, looking at risk factors for OSA. If they have rhinitis, septal deviations, upper airway crowding, these are all areas that you can educate these specialists on and how OSA is tied to them. And as you're going and trying to expand your footprint and how you're trying to get your practice and showing your sleep physician how you can expand the practice, keep in mind that things don't happen overnight. This is not an overnight plan. So envision the future for your center. What do you want it to look like? And then start creating tactical tips for how to expand the sleep tech role in your center. Be realistic with it. You know, it's great to have big picture ideas, but you also have to be able to do things that are capable. You know, you have to keep, and SMART goals are one of the things I always try to emphasize. You know, you want to have it specific, measurable, attainable, relevant, and time bound. And create baseline metrics to show how this role is expanding the practice. So show how this role can be used to get more patients in the door. And then show marketing plans for how you can target these collaborative areas. How will you reach out to these other specialties? And what is your plan to educate those folks on how we can work together as a sleep center with their practice? And web presence is great. You know, TikTok's a big thing, Instagram, having a LinkedIn presence, Facebook. These are all things that, you know, if you're going and networking with the community, and showing what you can do, social media can be a big thing. Also participating in community events, having a booth at like a 5K, for example, that's going on in your community, or some big community event that's going on. Having a booth there and showing how you can help somebody sleep. Those are all key ways that you can go and start getting people in the door. And then as far as more informational resources for CCSH, one of the big questions that I always get is, how do I get reimbursed for this? The BRPT does have on their website, if you go to the CCSH section of our website, there is a sleep educator reimbursement guide that shows how various labs and clinics are using billing codes today for these roles. So that is a way that you can go and look at how you could possibly get reimbursed for this. And if you want to learn more about how to use this role, as I mentioned in an earlier slide, there are the CCSH STAR programs. My college actually has one of these STAR programs. They're module-based learning programs that can teach you how to utilize this role and how to prepare for the CCSH exam. You can go on the BRPT's website and click on the STAR programs to look at what is available for CCSH. And then coming up on November 4th and 5th, there is actually a conference that is dedicated to utilizing the CCSH role in practice. The CCSH Advanced course, Integrating Innovation and Critical Thinking. That is a 1.5 day conference that is just purely on CCSH. It's in Washington, D.C., and it is put on in conjunction with the Society for Behavioral Sleep Medicine. BRPT is one of the co-sponsors on there as well. And so that's another course that if you are available in 2 weeks, or actually a week and a half to come out for that, then that's another opportunity to learn more about how to utilize the CCSH and to get more skill sets in this role. So are we ready to move into the future and to kind of think beyond the walls, think outside the box of how we can utilize our sleep technology role, especially with this being Sleep Tech Appreciation Week? How can we expand our footprint and show our physicians and our collaborating physicians how we can be very useful in their practices? I'm going to open it up for questions. I know Rachel's facilitating questions for me. And are there any questions I can answer?
Yeah, wow. Your presentation was so thorough. You answered most of the questions that popped up in the chat. So yeah, and shameless plug, the opportunities for collaboration, I was fascinated by that section. We are doing a Women in Sleep webinar in December 8th. It's not on our website yet, but we will specifically be covering some of the different things that women encounter as far as like sleep disorders through various stages of their lives. So keep an eye on our website for that. All right, let's see here. Let's see here. You mentioned ways in which I can get this role covered by my administration. You gave some great practical steps for that. How do you recommend I approach my administration?
So have a plan together, because you want to have a detailed plan of how you're going to market this, how you're going to get the other providers involved. So having a concrete plan, so coming up with, as I mentioned, SMART goals, specific, measurable, attainable, relevant, and time-bound goals that you can set out as this is kind of my, and then creating an action plan from that of how you're going to approach it. So if you're, the more detail and kind of the more you think through this and show them also how this will impact the bottom line, because a lot of times administrators, it all comes down to dollars and cents, and to show them how that's going to impact their bottom line, that's another key thing. So plan and showing the bottom line.
Okay, so kind of along the same lines, what is the range of pay for CCSH, and how would one show their value to be paid for their services until those codes are approved for reimbursement?
I have not seen a defined dollars and cents kind of range for this. I've seen it all over the board, some that are just, still in kind of the RPSGT pay scales, to some that are kind of incorporating into their management roles. So some of those management roles are paid a little bit more, but I haven't seen like a defined pay range. And I think as we start to see more step into this role, we'll kind of start to see. If you're showing how that's bringing value, you can always use that as a bargaining chip that, hey, I've brought in this amount of volume into the sleep lab, and use that as kind of your way of, here's why I deserve a raise pitch.
That's great advice.
Yeah.
Okay. I want to sit for the CCSH exam, but not sure I'm ready. How do you recommend preparing for it? What do you recommend to study with?
Well, if you've not done one of the CCSH STAR programs, I would encourage those, just because, like, I don't know the other programs because I'm not involved with those, but I know, like, in my program, we have a 100 question practice CCSH exam as the final exam for the course. So if you pass that, and I've been told it's a little harder than the actual CCSH exam, if you can pass something like that, you probably are a good chance that you're going to pass the CCSH itself. So taking one of those CCSH courses, taking the post test and seeing how you do, usually is a good indicator if you're going to do well on the exam.
Okay, great. Let's see, here's another one. What advice would you give to technologists in the field for their careers?
What advice is, be adaptive to change. Don't be afraid of change. Keep in mind that change is always going to take place. If you stay too complacent, they'll find somebody else that will do the role that they want them to do. And so be adaptive to change, as you learn and evolve, and also keep up with education. The more you know, the more valuable you are. I always tell my students that, you want to be as marketable as possible so that you can do any role within this profession. So the key to being marketable and being able to step in any role is education. So the more you learn, the more you can advance.
That's understandable. Oh, here's a good one. How often is the renewal, if any?
So it's every 5 years, just like the RPSGT. So it is
Okay.
50 CEUs renewed every 5 years, just like the RPSGT, but there is overlap with CEUs. So if you're worried about having to maintain 100 every 5 years if you have both credentials, not the case.
Would CCSHs be able to work as independent consultants or only under physician direction?
So the only ones that I know that are working independently are the sleep coaches, but most of them are cash pay and not going through insurance that I'm aware of. So at least the ones I've talked to, that's the only ones that I know that are doing kind of their own thing. But usually, because this is part of the clinical sleep care, it should be under the auspices of a sleep physician.
Okay, great. Well, I just want to thank you again, Amber. And then finally, if you do want to learn more about Enzo Sleep, our sleep study management and scoring solution, please explore our website. You can always reach out to us at team@enzodata.com. And thanks again for joining us.